Hi, I'm Ruth, physiotherapist at Complete Pilates. October is Breast Cancer Awareness Month, and this year it seems more important than ever that we bring awareness to the early detection of cancer, the early treatment and the rehab required afterwards, with so much focus on the COVID-19 pandemic. Because of the COVID-19 restrictions in place and the challenges for healthcare in the UK, it's estimated that up to 1 million women may have missed their screening for breast cancer so far this year. And that could equate to 8,000 women who should have been diagnosed with breast cancer and perhaps haven't been yet. Usually there's around 5,000 women a month who are diagnosed with breast cancer in the UK. 1 in 7 of us will be affected by breast cancer at some point in our life. But the great thing is that up to 25% of those cancers are preventable. So if we can look at the factors that reduce the risk of breast cancer, we can prevent a lot of these diagnoses. The numbers of women surviving breast cancer are increasing each year, with around 90% surviving for at least 5 years and around 50% surviving for at least 10 years. These rates are improving and mean that people will need to return to a high quality of life and get their life back after cancer treatment. We know from the research that exercise can help at all stages, in prevention, during treatment, as post-operative recovery, and rehab and preventing recurrence of breast cancer after treatment. However, even with this information, we know that the majority of people, both in the general population and those who have been diagnosed with cancer, are not achieving the recommended levels of exercise. We want to increase the awareness of how important exercise is as part of cancer care and how Pilates can help with that. So what are the stats? What's the research? The effects of exercise on cancer are significant, and if we could take exercise as a pill, it would be the most commonly prescribed pill in the world. Exercise can reduce the risk of getting breast cancer by up to 30%. And this is for a variety of reasons. Physical activity actually lowers the levels of certain hormones circulating in your system. These include estrogen, androgen, insulin, and certain growth factors. And we know that raised levels of these within your body are associated with breast cancer. So it has an effect on a hormonal level. It's also known that exercise, increasing exercise in your daily, weekly, monthly routine helps to encourage other positive lifestyle changes which also reduce your risk of cancer. So what about breast cancer specifically? Well, we know that for breast cancer, higher intensity exercise is advised. So women who do 3 to 5 hours a week of higher intensity exercise, so that could be dancing, running, tennis, have a lower, reduced risk of getting breast cancer. So what about if you are having treatment for breast cancer? Well, exercise can actually improve the curative effects of treatment. It improves the efficiency of radiotherapy. It helps to promote cell death of cancer cells. And it improves your blood flow and your circulation generally, which helps the function of chemotherapy drugs around your body and the formation of new and healthy vascular systems. We've all heard about the negative side effects of cancer treatment and people who are having chemotherapy. And these can include fatigue, feeling sick, loss of muscle strength, loss of bone density, as well as other side effects. And exercise can actually help these side effects. We often think that if you're fatigued, you need to rest up and not do too much activity. But actually the research has shown that the opposite is true. If you are active and you are exercising, you are less likely to suffer symptoms of fatigue when going through treatment for breast cancer. What about your prognosis after treatment for breast cancer? Well, again, exercise can help. It can actually increase the survival rates by 40% in breast cancer. And it can also help prevent recurrence of the disease. It is the most proven method of reducing the risk of recurrence of breast cancer. exercise is top of the list. We need to make sure that we're encouraging physical activity and giving people the opportunity and advice and education on keeping physically active and exercising regularly. The other thing that we're interested in as physiotherapists who teach Pilates is the specifics of rehab after breast cancer surgery. So there's a variety of different types of surgery that patients may undergo. Mastectomy, they may have breast reconstruction, and these can affect not only the breast area but your shoulder, your back, down into your abdominals. All of these areas can be affected in the surgery, or tissues from those areas used as part of your reconstruction. So physiotherapy and Pilates exercise specifically can really help to improve your scar healing and remodeling, your range of movement in the shoulder and your spine, your muscle strength, help to increase your bone density again after treatment, also help to activate your core muscles, your abdominal muscles, and give you strength through your trunk, and reduce risk of swelling and lymphedema, and help with any sensory changes in the arm that might be associated with the surgery. These are all areas that we look at regularly after surgery, after operations, that are all relevant to surgery for breast cancer, but sometimes aren't considered because we're so focused on that surgery being the treatment to get rid of the cancer. We need to also focus on that life after surgery, the recovery and the rehabilitation. So what should you do? Well, as always, the advice really should be individual and specific to you, specific to your body, your health history, your diagnosis, your treatment. But in general, the exercise recommendations are the same for the rest of the population. We want to be doing 150 minutes a week of moderate exercise. This should include a couple of strength training sessions, which can be a variety. They don't have to be weights in the gym, but can include weights, can include Pilates and body weight. And for breast cancer specifically, women should be doing some higher level intensity exercise as well. If you're unsure of what to do for you at your stage of diagnosis or treatment, or perhaps for prevention, then do get in touch. You can speak to us at Complete, or you can find a specialised practitioner in your area. PINC STEEL is a great organisation that train physios in all areas of cancer rehab. So that's a good place to start, to find somebody who's qualified and can give you the individual assessment and advice that you need.